Hey, welcome back. It is Phil Valentine Show, Super Talk 99.7 WTN. We've got Senator Rand Paul is on Skype with us, and so we hope this whole thing is going to work. How are you, Senator?
Very good, Phil. Thanks for having me.
Hey, my pleasure. Several things we want to talk about. First is this spending. I saw you were parlaying today, and we'll get into all that in a moment. People parlaying instead of tweeting. And you were talking about the gold price, and the gold price is going up. And, of course, this massive spending that we're doing. When does this stop, and what kind of long-term repercussions does this have?
You know, I hope it doesn't end with the end of our currency. But it could. That's what they were talking about in the article this morning, that the price of gold is so high that people are so uncertain of the value of our currency. We basically borrowed $5 trillion in the last 5 months. We've never done this. This is a historic spending spree, and I hate to tell you, but it was done under big government Republicans, particularly in the Senate. And right now they're planning on spending another trillion. That's what they're starting with, another $1 trillion we don't have. So altogether, we're going to have about a $5 trillion deficit this year. And I'm just sick and tired of it. That's why I've gotten involved in Manny Sethi's race. I don't want another big government Republican. I don't want another rubber stamp for the Republican leadership. Frankly, we need new people and people with the guts and people who aren't afraid to vote for less spending and less debt up here.
And you and Manny Sethi are both doctors, and we see a lot of those. Used to be there were no doctors in Congress, and now we've got several. And you had coronavirus early on, too, and you've gotten part of your lung removed, my understanding is, from that attack from your neighbor. How did the coronavirus affect you? Was it tough on you?
I was like the vast majority of people who get this. The vast majority of people to get this are asymptomatic or mildly symptomatic. And, they make fun of the president for saying that most people get well from this. It is true. The vast majority, if you look at under age 18, the mortality rate's about 1 in a million. You look at age 18 to 45, the mortality rate's about 10 in 100,000. Above that, it increases. But interestingly, it is still pretty small. And the vast majority, even people up to 65 years of age, it may well be between 95 and 99% have a very mild case of this. So I'm not saying it's a benign disease. People do get sick and die from this. But your chances are good. We shouldn't live in fear forever. We should take normal precautions. We should assess the risks. People who are older should take more precautions. But we shouldn't, cover the faces of our children and say you're going to have to live your whole life with a mask on. We shouldn't do that, and the government definitely shouldn't mandate it.
Which brings me to this whole thing with the hydroxychloroquine and the doctors the other day that had the press conference, and they say they've treated patients successfully. You've got Dr. Rich at Yale, who is just screaming at the top of his lungs, we have got to start using this because it saves lives. Now, I know the jury's still out on it, but do we censor folks like that and pull their videos down just because they have a different opinion?
No, it's the opposite of science. It's the opposite of the scientific method to have social media deciding what is acceptable and what's not acceptable. During the middle of all this, when I recovered, I volunteered in local hospital in my town, and most of the doctors were using hydroxychloroquine. Now, the evidence is, I would say, equivocal. In studies with people who are very sick, when you give hydroxychloroquine, it didn't make much difference. But neither have most of the drugs. Even remdesivir, which is probably the best drug out there for very sick people, only had a small difference because people were very sick. Now, they had another study that the NIH was doing with people who were not yet in the hospital, mildly affected or mildly symptomatic. And the study was just discontinued the other day, but I think for political reasons. They said, we couldn't get enough people in the study. But the reason they can't get enough people in the study is you have people telling doctors you're not allowed to prescribe it, and we will sort of persecute you as a physician if you prescribe it. The other thing is they hysterically, like everything else, said, it's going to kill you, hydroxychloroquine. The evidence is equivocal whether it'll help you, but I can tell you I've had similar drugs when I've gone to Haiti and to Guatemala to prevent malaria, and so have about 50 million other people around the world, and they're a very, very safe drug to take. I'm not saying take it. I'm saying that we should explore whether or not it works or not, and there probably needs to be more testing. The hard part about testing a drug to see whether it works in the future, particularly if you're doing it prophylactically, you have to do it and watch it for a long period of time with a lot of people to figure out whether it makes a small difference. When they discovered that aspirin helped prevent heart attacks, it took studying men over 55, and they had to give them an aspirin for almost 10 years because it was a small difference to be able to figure out that it worked. So it's not easy to determine these, but we shouldn't have science squelched by political people who hate President Trump because President Trump has expressed an interest in it. They want to stop it. That is really the opposite of the scientific method. And so these people act like they are the true scientists. They're actually acting, I think, very juvenile in the sense that they're trying to prevent free speech and thought about something that may or may not work.
Which brings me to big tech. And they've been in the hot seat today in Congress in the hearings. And of course, they're saying, I heard Zuckerberg saying, well, the reason we pulled those videos is because this is dangerous. This could harm people. My understanding is you have to have a prescription for hydroxychloroquine, but we don't have any evidence. It may not be effective, but we don't really have any evidence that it's killing folks, do we?
And this is where, like, the governor of Michigan was trying to punish doctors who were using it off-label. Well, there are probably hundreds of different drugs out there right now that are used off-label. One reason they're used off-label where there's not an indication is it costs $1 billion to go through the FDA to get the indication. And some of these drugs are very cheap. Let's say a drug was invented in 1935 and it's been out there forever. No one's going to bother trying to get an approval for that drug. It's used in an off-label way. Hydroxychloroquine's cheap. It's been out a long time. It'd be almost impossible to get the government to approve it. But it's a real mistake to have these governors and others saying, oh, you can't use it off-label. I'm agnostic. I don't know whether it works or doesn't work, but preventing doctors from using it and preventing from people from hearing about it is really the antithesis of the scientific method, the antithesis of an open society where people rationally get to make their own decisions. It's a terrible thing, and we should all be opposed to it. And one way you mentioned earlier on is getting on other venues. If you don't like Twitter, don't use it. Get on Parler. That's what we do. We also still use Twitter. We still use Facebook, but we're for more competition. And ultimately, competition will make them treat their customers better. If people don't treat you well, don't use their service.
All right. And you've been a doctor a long time. I don't know whether you've ever seen this before because I'd never heard of it. But where the pharmacist refuses to fill a prescription from a doctor of this drug. I've never seen a drug so vilified in my life.
It's a Trump derangement syndrome. People on the left hate him so much that they're unwilling to listen to anything. I mean, but it is they truly are deranged. And the thing is it would be malpractice to tell doctors they couldn't prescribe it. Because the thing is every doctor is going to use their own. And people think sometimes everything is an exact science. There's a lot of art form that goes into doctors as well as their experience. So, for example, one of the things I'm intrigued by, even more than hydroxychloroquine, is actual use of steroids. And there's a pulmonologist. You may have seen this on the internet. He's been practicing 28 years. He's been on the governor's panel of experts giving advice in Texas for 10 years. And he's been treating some of his patients with inhaled steroids. And actually, most of the scientific community is saying it's a good thing, but you're still not hearing much about it because the CNNs and their ilk, they don't want good news. They're peddling bad news. They want you to be fearful. They want you to live in fear. And they want
at least until November.
At least until November. But really, it's going to go on longer than that because it's a mindset that wants you to live in fear so you'll submit. It's all about submission. In our state, we had a couple who tested positive and they said, you need to quarantine. So they said, okay, we'll quarantine. But they said, no, that's not enough. You have to sign a letter that says you submit to the will of the governor and that you will not seek any kind of treatment or go anywhere, even emergency room. You will not take your 2-year-old who's not breathing to the emergency room without permission from the state because we are in charge of you. It's all about submission. And they refused to sign it. And I think that that's great. In a free country, we need to stand up and resist. And like, for example, my governor in my state, I call him DWP, drunk with power. And many of these governors are. Who would have ever thought that a governor, one person, could dictate all the rules of the economy with no checks and balances?
They don't have the authority to. I mean, when is somebody going to? They do not have the constitutional authority to do this, but they're doing it anyway. I had some people that tell me they go across the line. If they go from Nashville to Kentucky, immediately they get a text on their phone that says, check in with the authorities. You're supposed to call this number. They said, screw it. I'm not going to call you. But they want to track everybody who comes to the state.
He's been struck down 3 times by the federal courts. Once for banning people from going to church. another for a forced quarantine when coming back into the state, and another for, here's the hypocrisy of this guy. He says, oh, you can't have more than 10 people together in one room. And as he pontificates about this in his press conference, he's got like 35 people in the room listening to his pontifications. He breaks his own rules. It's sort of like Fauci at the ball game having a good old time with his mask off, sitting about 12 inches from people. So it's, the bottom line is, in a free country, everyone assesses risk. And I'm not saying there's no risk. This can be a deadly virus and people do die from it, and everybody should learn about it. But really, in a free society, you assess your own risk and make your decisions. Cars are dangerous, so are motorcycles, so are bicycles, whether you ride a bicycle on the road or on a path. All of these are decisions we make every day. For young people, the statistics, and no one will say this, but for those under 18, the seasonal flu is more dangerous than COVID. But we don't stop school forever for the seasonal flu. We don't go hysterical. We don't say you're going to kill the teachers. We treat it in a rational way. And if 10 or 20 kids at a school get the seasonal flu, because it does have some danger, we sometimes will close the school for a while and we'll try to get over the seasonal flu. COVID should be the same way. If it turns out that it's worse than that, then we should treat it more significantly. But right now, we've closed all the schools in the country, and we're not opening any of them based on no evidence, based on no outbreaks. There's been no outbreaks. And in fact, with childcare, 40,000 kids had childcare in the middle of the New York pandemic, with people dying left and right. And guess what? They had less than a 0.2% incidence of kids getting it. And of the 9,000 adults taking care of the children of essential workers, 1% got COVID. So it can be done. We have seen that even in the midst of New York, which did worse than any place in the planet, Cuomo should get a prize, but his prize should be the booby prize for having the worst death rate of any place on the planet. Guess what? The daycare stayed open and had very little problems.
Well, that reminds me, because he came back from Georgia. He's supposed to quarantine for 2 weeks. They asked him if he was going to quarantine. He says, no, I'm an essential worker. Really essential. So I want to ask you a couple more things, and I know you got to run because you're real busy up there, obviously. But the putting these patients back in nursing homes, we're doing that in Tennessee. A third of our deaths are from nursing homes, but yet they just put the COVID positive patients back in nursing homes. And then they say, well, we're going to isolate them. We don't know whether this thing can be transmitted through air ducts or whatever. We just don't know enough about it. Isn't it rather foolish to put somebody that is COVID positive back in with the most vulnerable people in the population?
Well, that's what Cuomo did and Murphy did in New Jersey. And as a consequence, about half their deaths were in the nursing homes. You don't have a lot of choices. You have to figure out where some people go. The one thing I've seen that may work well in nursing homes, and they're trying, is if they have the ability to have more than one building there, that one building becomes the COVID building, the virus building. You have separate staffs and separate doors, and you basically become separate facilities. But if you've ever been or worked in a nursing home, it's a hard job, and people who are bed bound require a lot of care. And it's even with washing your hands and gloves and stuff, it's hard not to transmit things. It's just almost impossible in that setting. And then they're very vulnerable to it. So you could have separate buildings perhaps, or you can have separate locations. But if you have separate locations, it's either got to be a hospital or another nursing home. And those are possibilities. There are a lot of thoughts on how to make it better. The other thing is we are getting better. Nobody will broadcast any good news, but the death rate is going down dramatically. The people getting sick in Florida and Texas and Arizona are skewing much younger. Their survival rate is much higher. And ultimately, we are headed towards herd immunity. And somebody asked me the other day on television, they say, well, you're for herd immunity. I said, well, not necessarily, but I think that's where we're headed. I think everything we've done has sort of failed. Short of a vaccine, we're getting there. But the good news, like about New York now, which has nothing to do with government policy and all to do with immunity, is that in New York, there are very few people getting infected and very few people dying. Now, Cuomo will say it's because he's such a great governor and he's doing all this stuff and it's a lockdown. No, it's the reason it's happening in New York is I think they've developed enough immunity to have some protection. That's going on in Florida, Texas, California, Arizona. Within about a month, there'll be enough immunity, hopefully, that this will slow down. It's already happened in Sweden. And here's the thing. All these people hate Sweden because Sweden didn't lock everybody up and put everybody in jail. Interesting thing, I think there's like 12 states in the United States that have a higher death rate than Sweden. So you have to ask yourself, who did the better job? Sweden, which was relatively soft touch, they gave advice. People still tried to avoid each other, and they tried to avoid big meetings. They didn't shut down all the restaurants. Their death rate is better than about 12 of the United States, including New York, New Jersey, Connecticut, Massachusetts, Michigan. All these places that did a lockdown actually had a higher death rate than Sweden.
And that's the bottom line. You give people the information, you trust them to make the right decisions, and you let them exercise their freedom. Senator Rand Paul, always a pleasure. We'll have you back sometime to talk about all what's going on in Portland and some of these other places, but we appreciate your time very much. Thank you.
Thank you.